Unit 26. Exercise. Exercise 1. Complete the table with words from A, B, and C opposite to help you. Adjective: blind, conscious, deaf, dizzy, numb, lightheaded, unsteady. Noun: blindness, consciousness, deafness, dizziness, numbness, lightheadedness, unsteadiness. 2. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Double vision, epileptic fit, prodromal symptom, syncopal attack, urinary incontinence, visual acuity. 3. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's question. Look at C opposite in the table in 26 above to help you. Do you lose consciousness suddenly or gradually? Do you get a warning of the attack? What were you doing before you passed out? Were you worried and under any stress at that time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movement while you were unconscious? Unit 27. Exercise 1. Complete the table with words from A and B opposite. Noun: absence, disnutrition, flaccidity, spasticity, wasting. Adjective: absent, distended, flaccid, spastic, wasted. 2. A doctor is having intrusion from a patient during the examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. 1. I like to relax. I'm just going to move your arms and down, up and down. The muscle tone. 2. Can you see your hands? Muscle bulk and possibility involuntary movements. 3. Now I'm going to stretch your arm out, trying to stop me. Power. Can you touch my finger with yours? And then touch your nose. Good. Now do it again with your eyes closed. Coordination. Complete the sentence. Look at A, B, C opposite at the table in 27:1 above to help you. 1. A flaccid hand drops limply to form a right angle with the wrist. 2. Brick reflexes are reflexes that are stronger than normal. 3. Muscle wasting means the muscle is reduced in bulk. 4. A tic is a form of involuntary movement. 5. A key is often used to test the baby baby kid responds. 6. His coordination was poor. He couldn't perform rapid alternative movements. 7. A tendon is used to test reflex. When something is dismissed, it is less than normal. 4. A patient is brought to A&I in coma. When her name is spoken, she opens her eyes, but she doesn't answer questions but obey instructions. That is her CPS score. Open an eye, touch, verbal response, motor response. Unit 28. Exercise. Exercise 1. Complete the table with words from A, B, and C opposite and related from verb, nouns, and adjective. Verb: cure, curative, curative. Excise, excitation, grow, growing. Invade, invasion, invasive. Obstructive, obstruction, obstructive. Palliate, palliation, palliative. Palpate, palpation, palpable. Spread, spreading. Swell, swelling, swelling. Exercise 2. The note below are about the patient describing in B. Use the term to put the sentence in the correct order. To make the next paragraph of the case report, use appendices on page 20 if you need help with the abbreviation. 6. On examination, his temperature was 37 and 37.8 Celsius. 3. There was a smooth firm 3 times 4 centimeters mass in the right supraclavicular fossa. 7. There were large lymph nodes in both axillary and inguinal areas. 2. His mouth and his throat were normal. 8. His pulse rate was 100 per minute. Regular blood pressure was 112 66. 4. His cardiovascular and respiratory system were normal. 5. An abdominal examination, there was a mass palpable 3 centimeters below the left costal margin. 1. Examination of the central nervous system was normal. Exercise 3. Complete the sentence. Look at A, B, and opposite to help you. 1. Distant spread of tumor cells is known as metastasis. 2. Many symptoms of cancer, such as difficulties swallowing, are due to painless. The opposite of painful is obstruction. A malignant neoplasm is called cancer. Tumors which do not involve in metastasis are benign. Secondary tumors are those which result from the expression of a primary. 7. If a cure is not possible, palliative treatment should be given. 8. A palpable liver suggests metastasis. Unit 29. Complete the sentence. Look at A, B, and C opposite to help you. 1. A baby that is born a week before the EDD is premature. 2. A termination of pregnancy may be necessary for medical reasons. 3. The first 3 months of pregnancy are known as the first trimester. 4. The fetal distress in the first stage of labor section is an indication of casestrain. 5. It was a breech presentation and delivery was by forces. 6. A miscarriage is another term for a spontaneous abortion. 7. The cord was wound tightly around the baby's neck and it was unfortunately stillborn. Exercise 2. Complete the table with words from A opposite. Verb: abort, deliver, induce, miscarry, present, terminate. Noun: abortion, delivery, induction, miscarriage, presentation, termination. Exercise 3. Dr. Bennett, an SHO, is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with words from form of the verb from 29.2 above. This is Clara Davis. She came to antenatal clinic at 9 weeks. In her past obstetric history, she had a pregnancy when she was 18, which was terminated and another 1 year later with spontaneous abortion. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she has an induction of labor at 39 weeks because of fetal distress. The third baby presented as a breech and was delivered by cesarean section. Unit 30. Exercise. Exercise 1. Make word combination using a word from each box. Look at A and B opposite to help you. Blood, stain, breath sounds, pleural rub, productive coach, vocal resonance. 2. Rewrite the question using words that are better known as to patient. Look at A opposite to help you. Is your cough productive? Is it a loose cough? What color is the sputum? Is it Is it yellow? Is it ever purulent? Is it planked? Have you ever had hematosis? Have you ever noticed blood in it? Do you suffer from dysphonia? Any problem with your breathing? Exercise 3. Are the following statements true or false? A patient who has a loose cough produces phlegm. True. Crackles are heard when the airways are narrowed. False. A patient who has a non-productive cough produces sputum. False. Wheeze are typical of pleurisy. False. A pleural roof is a sign of asthma. False. Complete the description of herpes zoster by replacing the medical words in brackets with ordinary English words. Look at A and B opposite to help you. Shingles. Usually start with pain and soreness in red spots appear that develop into groups, small blisters, or a particular area on one side of the body. In most patients, new blisters continue to appear for 3 or 4 or 5 days. The small blisters filled with pus and then from scabs. In severe cases, there are many scars afterwards. Exercise 2. Read the description of the rash of rubella and complete this note. Look at A and B opposite to help you. The spots are scratched and pink masks which appear from behind the ears and on the forehead. The rash spreads rapidly, first to the trunk and then to the limbs. Location and distribution. First behind the ears and one of the forehead, then the trunk and limbs. Grouping scratched. Type of lesion, maculous. Color, pink. Complete the nose and the rash in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution. White spread out on the chest and abdomen. Groping, scratched. Type of lesion, small maculus with some scales. Color, pink. Exercise 4. Complete the nose for the lesion in the photograph and suggest diagnosis. Look at A and B opposite to help you. Location and distribution. Below the lateral end of the lateral angle of the left eye. Groping, nodal. Type of lesion, white, pink. Color, white and pink. Unit 32, Exercise 1. Write the corresponding medical terms for the ordinary English words and say what kind of force is involved. Look at A and B opposite to help you. Common word: bruised, cut, graze, scratch, stab, wound, tear. Construction, medical term: contusion, inset wound, abrasion, linear abrasion, penetrating, laceration. Type of force: blunt, snap, snarp, blunt, snarp, blunt. Exercise 2. Choose the correct word to complete a description of the injuries shown in the illustration. Look at A and B opposite to help you. There are grazes above the left elbow and the left side of the neck, a contusion to the left side of the lower lip, and tears on the left cheek. 3. Write a description of the injury shown in the illustration. Look at A and B opposite to help you. At 32.2 above to help you. There is a laceration on the left shoulder and an incisive wound. A cut approximately 6 cm in length above the left nipple. 4. Complete the sentence. Look at A and B opposite to help you. 1. Frequent change of position are necessary in the involved patient to prevent the development of pressure sore. He had several stab wounds in the abdomen from the knife. He was knocked unconscious by a heavy blow to the head. The wounds were only superficial and required no treatment. Unit 33. Exercise 1. Look at the conversation in the opposite and complete the notes about Mr. Young used medical terms where possible. CO, frequency and nutrition. 1. Junior, no dysuria or hesitation. Steam, a little weaker, not intense apart from occasional dribbling. 2. Match the patient description of their symptoms with the medical terms. Look at opposite to help you. I have to pee every half hour or so. Frequency. I get an scalding pain when I pass water. Dysuria. I have to get up several times to pass water at night. Noturia. I had to rush to the toilet. Urgency. I had trouble getting started. Hesitating. I can hold my water. Incontinence. I passed some blood in my urine. Hematuria. Exercise 3. Complete the doctor's question from each of the symptoms in 33 and above. Look at A opposite to help you. You will need to think of your own question for urgency. These were a trace of blood, grass, proteinia, and no cast. 4. Describe the finding of the laboratory reports in words. Look at B opposite to help you. Blood ++, protein ++, cast meal.